Welcome, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachowa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session is Resilient Back, how to build a resilient back. We're going to talk about exercises for a healthy spine. So a little bit about me. I'm a physical therapist, an orthopedic clinical specialist, certified golf medical professional, certified dry needling specialist. And I've been in the PT field for over 25 years. I got my doctorate from Mercy University in Dobbs Ferry and an exercise physiology degree from Rutgers, New Jersey. So today we're going to be talking about a lot of stuff that can be helpful for dealing with back issues. Let me just pull up my slides here. And if you do have some specific questions, please feel free to use the chat function. And I want to make this session as helpful and informative as possible. All right, so the back, is often seen as one of these things, especially if you're dealing with chronic things, that goes out. It kind of is fragile. And, recently I had somebody come into me yesterday that really was afraid to start to pick things up or, pick up a laundry basket or get groceries out of the car. He was a little apprehensive about bending and moving because his back would often go into spasm and go out. So today we're going to cover a lot of the things that you can do on your own to help maintain a resilient back. It's an opposite concept. Instead of having something totally fragile and feeling like it's going to go out at any moment, we want to make it durable, bulletproof, resilient, so that you can do things that would normally be difficult and make them easy, and you can be confident that your back doesn't bother you. So just because I'm a physical therapist, a medical professional, I have to put up this disclaimer. So if you're dealing with something specific, all the stuff that we're going to be talking about today is very general and aimed at a broad population. If you're dealing with something specific, please go get a thorough physical exam so you can have all the associative factors that are connected to your back addressed. Okay, so this is kind of like a general thing. If you've been to any of my talks before, any of my classes, you've seen this video. All right, if you take anything away, remember this, that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. Now, if we're looking at this diagram here, and we're looking at this alternating pattern of stability and mobility, the lower back is designed to be a stable segment, right? And then the segments above that, because we're alternating, the thoracic spine is a mobile segment, and the hips are supposed to be mobile. Oftentimes, we're looking at the back and we're just treating the back because there's something wrong with the back. But because we have pain in the back doesn't mean that that's where the problem is. Oftentimes, we have issues with the mobility of your thoracic spine, your T-spine, or your hips. And when those are not mobile, they turn into a stable segment. And then your body reverses the role of the lumbar spine and turns it into a mobile segment or unstable segment. So if we just focus all our attention and treatment at what's going on with the back, then that doesn't solve the problem. The root cause of the problem oftentimes lies elsewhere. And that's why back pain tends to recur. Come back again year after year or month after month. You do something that feels really good. It reduces the back pain, and all of a sudden you go to move, you go pick something up, and like, oh, my back went out again. So we have to make sure that we address everything above and below the chain, this kinematic sequence here of segments in your body. A little bit closer, the body will adapt to the positions you put it in. And the curves that we have here, you can see in this middle diagram, the middle picture here, there is a curve, a cervical, thoracic, and lumbar curve to the spine. Our bodies adapt to the positions we put it in. So if we're most of the time flexed and sitting, our body adapts to that position. And then we start to lose these curves. We want to be able to maintain them, restore them, and maintain them. It's because curves withstand forces and loads better than a straight spine, okay? And we want to be able to look at what are some of the common causes of back issues, mostly we get strains, all right, where a muscle gets overworked or overstretched, it goes into a spasm. So we're going to talk more about what the core is. We're going to talk about abdominals, back muscles, hip muscles, and these muscles help to support our body. Now, in the back, we have muscles that kind of connect bone to bone, joint to joint. We'll see a slide about that later on. And these are the ones that typically go into spasm and feel like your back feels unstable, because that muscle is kind of like in an on position. Normally, muscles should be able to relax, turn off, and turn on, lengthen, and shorten as we move. And if a segment or a little piece of that muscle just goes into a spasm and doesn't want to let go, then that inhibits everything above or below that muscle from working properly. And then we get symptoms like acute back pain or referral symptoms that might go out from the spine to the hip, buttock area, or down the leg. Radiating symptoms, like if it's a nerve or sciatica, sometimes that is a general term that we apply or put on a lot of different things, and it might not be a nerve problem. Referred pain is where pain gets kind of felt along somewhere else in a body, but the root cause is something like a muscle trigger point that can mimic radiating sciatica, but it's typically not. I don't know how many times people have come to see me in the past 6 months that have said, oh, my doctor says I have sciatica, or my chiropractor says I have sciatica. I need to treat this nerve. But then we do the tests here, and that nerve doesn't respond to any of the tests. And we find that it's just a trigger point that's causing this referral symptoms down into the buttock or the leg. All right, a little bit closer look here. These are the abdominal muscles. Now, the most important one is the transverse abdominis. In the abdominal region, there's 4 different layers generally, right? We have the rectus abdominis, which is the straight up and down muscle in the front, the internal and external obliques, and then the deepest one, let me see if I could pull this up, you can see, the deepest muscle is the transverse abdominis. It runs around from the back to the front like a girdle. That's like your body's own back brace. If you've seen back braces that are like Velcro things that you kind of strap on to support your back, your body has one, and you should be able to use it. If you're using a back brace to support your back, basically you're inhibiting that muscle in your body from working and functioning correctly. Your body learns that it doesn't have to use it because you're using external support, and then all of a sudden you can't live without it. All right, and then the next one, if we look to the back, these are the smaller muscles. Now, the one that typically is the one that we treat in the clinic, we find the most dramatic effect with reducing back pain is the multifidus. I'm going to blow this up so you can take a closer look at that. So we have all these different muscles in the back. The ones that are closest to the joint, the spine, the nerve, is this multifidus. It is right along the middle. If you could see that in the middle there, that's the muscle that can mostly go into spasm, other than the quadratus lumborum, which is another muscle that that's more superficial, that does go into spasm. But the multifidus is the one that most commonly causes these referral symptoms, and it mimics a disc issue. It's like, hey, there's a disc problem, I got a herniated disc, it's like right there. And again, you know, your body, your spine is more resilient than you give it credit for. And these discs oftentimes are not the problem, because you just have an MRI finding that says, hey, we've got a disc problem, because that MRI finding is done in a usually supine lying down position. It doesn't accommodate for gravity and standing or movement. So that's just a small snapshot of that disc, and it might not be the root cause. So yeah, so this is the quadratus lumborum here, and you can see how it comes from the lower rib. You can see at the top there, it's that last rib, and it goes down to the pelvis. This is the view of your body from the front, all right? So if we're looking back, you could see the spine down the middle there and that quadratus lumborum. And the other thing that's important in this picture here, let me pull this up again so you can see, is the psoas muscle, the psoas major, and the iliacus. The psoas muscle comes from your lower back, dives through the abdominal cavity, and joins up with that iliacus muscle. and inserts into the front part of your hip. And oftentimes that can be one of the reasons why people have a hard time standing up, lifting, and moving, because that muscle has adaptively become short. Those two muscles join up in the front part of your hip, and we call it the iliopsoas muscle. All right, so what do we do to make your spine more resilient? We need to activate that transverse abdominis. People with chronic back issues usually have no idea how to activate that muscle. You have no motor control or brain muscle connection to that muscle. So we got to do that. We got to create that control and activation, strength, and endurance in that muscle. And then we got to do mobility exercises. We have to be able to, like I said, your body adapts to the positions and postures you put it in. So we want to move through a normal physiological range of motion, right? Being able to squat, bend, touch your toes, all of those things are normal. You should not lose that range of motion as you age. You lose it because you don't go into those positions. And then third, we want to look at some core strength exercises. So if we use the core, the abdominals, and strengthen those and make a better brain to muscle connection to those muscles, then we can reduce all this strain and back pain and then make your body more resilient, more bulletproof. All right? Oh, I got a question here. Can the psoas be made stronger again and longer? Of course, any muscle. If you stretch it properly, it can lengthen. But the second part of lengthening a muscle is the ability for that muscle to relax, okay? A muscle will only lengthen if it is relaxed. If a muscle is too tight or too on, has a high tone, then you can't lengthen it. And sometimes muscles will stay on a high tone because your body is using that muscle for stability or movement. It's a reversal of a lot of these muscles from being a stabilizer and being a mover, or a mover and then turning into a stabilizer. Sort of like that previous slide that I showed you about that alternating pattern of stability and mobility. I've seen people that come in and say, hey, you know, my hamstrings are really tight. I need to stretch out my hamstrings because I've read somewhere that tight hamstrings equal a tight back. Well, when they come into the clinic and we test out the length, the actual flexibility of their hamstrings, it turns out they're normal. Why do they feel tight? Because length is different than tone. And if a muscle is on and does not want to turn off, it will feel tight to you. In that example, this guy was using his hamstrings in replacement for his glute muscles to hold him up against gravity. So with that in mind, let me pull up my 2-shot, and then we're going to talk about all this stuff. So one example I mentioned earlier is, like, again, hamstrings feel tight, and then that can relate to a lower back tightness. It's not really the case, because the test that we did was just bending forward. And if you're bending forward, for example, and trying to pick something up, and what is holding you up in this position, people with chronic back issues, it's usually feeling it in the back and feeling it in the hamstrings. But the glute muscle, the hips, the glutes, big glute muscles here, they're the ones that should be holding you up against gravity, not the hamstrings or the back. Because the hamstrings are on and holding us up against gravity, then they tend to feel like they're tight, like they're always on. But if we relax them, turn them off, and then go down, we can get all the way down without having to feel that tightness. All right, so first thing that we're going to do is we're going to talk about some mobility stuff, mobility exercises. I got my bench here. Let me slide this back a little bit so you can see my body from the side. Oftentimes, we'll spend 6 to 8 hours of our day in this position, just sitting. And because we have this hip flex position, our body adapts to that position. And then when we go to stand up, and this is shortened and it's constantly flexed, we go to stand. And then when we have tightness in that iliopsoas muscle, then we try and stand up and extend the hip, but the hip gets tight. It's so bound down right here. And then we go to stand up, and then we get up like this. So my back is overarched, it's overused, and I'm walking around like this using my quads and my back muscles. And those are very strong on a lot of people that come in. And they say, hey, you know, why does my back hurt so much? Because we lack the ability to fully extend the hip because of the tightness in here. And again, if the muscles in the front are tight, they inhibit the ability for your body to contract this muscle. It's not like you can kind of work against that tightness. Your body says, hey, it's too tight in the front. I can't really activate that muscle. So it's sort of like trying to drive your car with the parking brake on. It doesn't work, right? So you have to release the front in order for the muscles on the opposite side, the back, to work properly. All right, back on track. Our first exercise is going to be a slouch, sitting slouch and overcorrection exercise. All right, it's just to get the back and the spine moving to stimulate blood flow into the discs, circulation, into your back muscles. So you're just going to sit, hands on your knees, and that'll be your reference point in terms of stability. We don't want the shoulders or the head to move. And then we're going to slouch. When you slouch, I want you to feel like your pelvis tucks underneath you. Tailbone comes underneath you. It takes your pelvis and rotates it backwards. And then when we overcorrect or sit up nice and tall, we take the pelvis and we tilt it forward, right? So this is the slouch and the overcorrection exercise. So down and then back up. So down and then back up. Try to keep your head and shoulders still. The movement comes from your lower back and your pelvis, all right? Slouch and then overcorrection, right? So this movement, very gentle. You move through a comfortable range of motion. Don't push through pain. Just get your spine movement. Movement will always help improve blood flow and decrease pain, all right? We can take this movement and go into a horizontal position. Same shape, same movement, but different shape. Where we go on to your hands and knees. The knees are directly below the hips. And then my arms are directly below, my hands directly below my shoulders. And then we do the same thing. Tuck my pelvis back, rounding out the back, tilt my pelvis forward, arching my back. So I'm going here and then here. Again, pelvic motion tilts, and pelvic tilting moves my lumbar spine. So that movement right there, again, will help get nutrients into my lower back and mobilize my spine and get those joints moving. Okay, so the next one is a hip flexor stretch. Now we talked about why your body adapts and then gets short here because we're sitting. The way to stretch that out is to get into a kneeling position. So you can do this in a lot of different ways. If you want to put something underneath your knee to pad it up, that's fine, doesn't matter. But what we do is that, again, this muscle, it inserts into the front part of the hip, but it starts on the lower back. So it crosses the lower back, goes through the abdominal cavity and the pelvis, and inserts into the front part of your leg right here. We want to stabilize all of the muscles and all the spots that muscle is attached to. So first thing we got to do is, in this position, squeeze your butt cheek. When we contract this butt cheek, we get that posterior tilt of the pelvis, right? Contracting that butt cheek. That keeps the insertion point in the front part of my thigh stable so that I can get an effective stretch. The next piece is to turn on the abdominals. Keep the ribs down into the belly. That flattens out the back. Keeping the back flat and the glute on, abdominals on, we're going to bring all of this forward. And as I go forward, I should start to feel this stretch down the front part of my leg. Check the leg here, make sure that that foot is directly behind me. I don't want it to be across my body, so it's directly behind me. And then contract here, get tight, hips go forward. And I should feel that easy stretch down the front part of my leg. If I don't keep these two parts contracted, then what tends to happen is that people will just go into the stretch and go inserts, and they don't feel it till later in the range when their back is arched too much. So we want to really make sure that our core is engaged, our abdominals are on, spine is stable, contract the glutes, and get that stretch earlier in the range of motion so I don't have to go deep and searching for the stretch. I get it immediately. And then when you do something like this, the static stretch, the recommended hold time is going to be 30 seconds. All right, 30 seconds. And then from there, you can repeat on the other side. You could also do this in a sitting position. If you're in your chair, you can't get on the floor, or if you have knee pain without weight-bearing position, even with pillows or padding underneath, you can do the same thing like this. Open up that hip, contract, get that foot to slide back, might get that stretch there. All right, so the mobility thing that we did was the slouch and overcorrect. We did a cat-camel. We could also make that motion a lot bigger by going into what we call child's pose or cobra. So I'm going to see if I can do it here, where I slide my hips back and I round out my back. My hands go forward. So this is a child's pose, right? Just kind of relax, fully rounding the spine. And then see if we can kind of work into the cobra, which is basically the opposite way, extending, holding myself up with my thighs in contact with the bench, arching the spine. And I can go back and forth. And certainly you can do this on the floor, on a yoga mat, doesn't matter. I'm doing it on the bench just so that you can see this move a little bit better. So extension and flexion. So it's a bigger spinal movement going from one position to the extreme condition, extreme other end range. And when you're doing this, keep in mind that you don't want to have pain when you do these exercises. There's an infinite number of ways to scale or modify an exercise routine that pain should never be part of that, all right? So if you're thinking that there's no pain, no gain, no. It needs to be comfortable, all right? Or else your body's gonna fight against that stretch. You're gonna tense up and not wanna do it again. So it has to be easy. There's a lot of different ways. We just went through a very easy cat camel and sitting slouch and overcorrection to this cobra child's pose. And the cobra child's pose is more advanced. So work within a range of motion that feels comfortable to you. All right, and then now we're going to go into this transverse abdominis muscle. All right, so this is important to stabilize and support your lower back. You're going to lie down on your back and your knees are going to be bent. Okay, when I'm doing this, it might not look like anything is going on, but trust me, it's very important that you control and make this brain to muscle connection to this muscle. So you find your pelvic bone, right, or your hip bone. Pretty easy. You could find it right in the front part of your hip here. It's like really pointy. You just put your fingertips on that and then dive in about an inch towards your belly button. If you're relaxed, that area should be soft. You should be able to push in. Because the transverse abdominis is the deepest of the abdominal muscles, this is the only place that you can palpate that muscle contraction. So what you're going to do is you're just going to pull in the belly button into your spine, or better, pull your belly button into your tailbone and feel that muscle get tense underneath your fingers. Now, that muscle is different than your diaphragm. Diaphragm is up here. So you should be able to feel that contraction, hold it for about 30 seconds to a minute, and still breathe. Diaphragm is a different muscle. You should be able to dissociate one muscle from another. A lot of times, people with dysfunctional transverse abdominis muscle motor control, people will hold their breath, they suck in, and then they can't breathe, but I'm really tight. But that's no way to function. You need to be able to breathe to function and breathe when you're lifting or carrying something. You can't just go from breath hold to breath hold. So you want to make sure that you can do that. Lying down is the easiest position to do it in. Gravity is actually helping that contraction, but you could certainly try it in sitting or in standing, right? Again, it's stabilizing areas. And this is much more difficult. If you can maintain that in standing, then your back will be less susceptible to going into a spasm when you're going to move or lift things if you engage that properly. All right, the next level is a curl up, okay? So a curl up, there's a couple different versions of this, but it's just extending from that one exercise, transverse abdominis activation, and making a bigger move where we lift the head and shoulders up. My head, shoulders have come up. I'm engaging a lot more on the abdominals to get to this position, but I need to make sure that the first muscle that turns on is that transverse abdominis. I turn that on and then I go into my curl up. It's just a little move. And focusing on creating that tension pushes my lower back, my lumbar spine into the bench, into the floor. And then as I come up, I feel a lot more tension. And for this, we might go up, hold it for like a second or two, and then back down, and work in sets of 10 to 12, all right? And then maybe 3 to 4 sets of that. Okay, so that's the curl up. And then we need to make sure that we engage the muscles in this area, our core, from a 360-degree standpoint. So we worked on the front, now we gotta work on the side. And one of the easy ways to engage the side is the side plank. So I just get on my side, my knees are bent. We plank from the knees, which is a lot easier than planking from the feet. I'm just gonna keep my knees bent. But the key is to lift my hips up and forward. And I check my alignment my hips and my shoulders and my knees are in a straight line. I don't want to have my hips back like this. They're still flexed. I want to squeeze that glute and get forward. And I'm just going to hold this position. You build up to 20 or 30 seconds of hold time, pushing through the shoulder and make sure that elbow is directly below the shoulder. So that's our side plank. So we get the side muscles, both sides. And then the other one to get the back is an exercise called a bird dog. So you get into this position that we were in earlier, hands below shoulders, knees below hips. We can get our cat-camel move where we're slouching and then extending the spine. Find neutral, like find where your middle is, right? Like where is the middle range of motion? Then you're gonna lock in that abdominal muscle, that transverse abdominis, and then you're gonna straighten out, hopefully I have room, right? Straighten out one leg, and then the opposite hand. So the opposite hand, opposite leg, lengthening from wall to wall, not floor to ceiling. We don't want to extend, overextend. We want to just go long and then long, and making sure that our midline doesn't move. We don't lose that position of our spine, and we don't lose balance. So that's the bird dog, holding for maybe about 3 to 5 seconds, and then maybe 10 times each side. All right? So I think that's pretty much covers all the core abdominal muscles, and also some mobility stuff that you can do at home to improve your back mobility and make your spine more resilient. All right, so let's come back to our first shot here and then see, we got some chat questions here. Is that what they call the cat-cow? Yes, I mean, it goes by the names of different animals, like cat-camel, cat-cow, same thing, right? You can call it the squiggly worm, doesn't matter. Is a bench exercise good for people who have osteoporosis? Bench exercise, and then I'm going to say that, is it a bench press where you're lying on your back and you're pressing the weight forward off of your chest, lying in a supine position? I don't think that that would be a good exercise for somebody who has osteoporosis. It's not bad. There's nothing wrong with being able to do a horizontal push of some type of weight, either it's your body weight or an external barbell or dumbbell. What's really good for osteoporosis is things that load your body in what we call axial direction, right? So it's a vertical press through these long bones. An excellent exercise for osteoporosis is a farmer's carry. Now, let's put that up and let's just see what that is. So what does that mean by axial load? When I'm doing like a horizontal bench press like this, that weight is this way, the weight's going through my arm and through my shoulder. Pretty good, that's not bad, but osteoporosis really affects our long bones, our spine, our femurs, our hips. We want to be able to get that weight through our body. So a farmer's carry is basically working off of just 2 weights, carrying them from one point to another, maybe 20 or 40 yards. Just working through here. I'm engaging my core, I'm engaging my glutes, and I'm walking as straight and as still as possible. And this is what we call axial loading. Another good axial loading exercise is a front squat, holding this weight out in front. I'm holding the weight, engaging it through my back, my shoulders, my arms, and I squat down. So movements like this, or a deadlift, where we're picking something up off the ground, those are more advanced exercises that will help with osteoporosis. All right, let's go into the bench here. All right, so the next one, we covered that. Are any of these not good for herniated discs? The exercises that we did are all good for herniated discs. The one thing is that herniated discs affect people differently. Your, I guess, barometer of whether or not an exercise works for you is whether or not it hurts. If it is truly a herniated disc and we go into a cat-camel or slouch and overcorrect or a cobra child's pose, and it increases your symptoms, don't do it. It's pretty simple. Usually, with herniated discs, symptoms are aggravated by flexion, bending forward, right? So just keep that in mind. If you're bending forward and it feels good, the chances of it being a herniated disc is fairly low. If you're bending forward and then you get symptoms going down the leg, below your knee, into your foot, and then when you come out of it and stand up straight up tall or extend, and that symptom is gone, then the likelihood is that, yeah, maybe it's something that has to do with the herniated discs. So it depends. All right, the first one you did on the bench. Are there any exercises for lower necks? Lower neck exercises. That's the question. Are there any exercises for lower necks? That is interesting. That might be a topic that we'll cover at a later class. Yeah, very different cervical neck issues, neck pain, resilient neck. That's a good one we might want to cover. But Zoe had written in here, the first one you did on the bench. Is the bench exercise good for people who have osteoporosis? The first one you did on the bench. I'm going to try and put that together. I would say all the things that we did here are good for osteoporosis. All the exercises I did on the bench are good for osteoporosis because one, we want to maintain normal physiological range of motion, and two, strength and stability in the lumbar spine. So all of that is good for osteoporosis. Well, except for the cobra. Sure, the cobra may hurt because you might be tight in the front part of your hips. So again, there's a lot of different ways to scale these motions. Don't do the cobra if it hurts. Stick with that cat camel or that sitting slouch and overcorrection. If you kind of work into that extended position and repeatedly do it, hopefully you can remodel those joints and you can eventually get into that position. But when you're doing the cobra, that also involves how much hip flexibility you have. How flexible are those hip flexors? If your hip flexors are tight, you're not going to be able to get into that cobra position. So you got to listen to your body. All righty. Great session today, everybody. Really interactive, and I love how you put the questions in the chat because I always, every time I come on here, I want to make this as helpful and informative as possible. All right, any other questions? I'm going to give you a 30-second countdown here. All right, anything else that you want to add in or questions before I let you all go? All right, well, thank you so much for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. You can join me, please, next time, April 16th. And the session that we're going to go is Recovery Essentials, the importance of rest and restoration. We'll explore the often overlooked aspects of fitness, recovery, all right, and discuss the importance of rest and restoration in achieving fitness goals, preventing burnout, and reducing your risk of injury. You'll discover effective recovery techniques, including proper sleep, active recovery strategies, all to support your overall well-being. All right. If you have any questions, you can always email me here at paul@par5pt.com or team@betterspaces.com. All right. Thank you, everybody, and be well.